My name is Dr. Andrew Coley. I'm the Senior Clinical Advisor for NHS North West. Today I would like to particularly talk to you about world-class clinical engagement. In the SHA, myself and some of my colleagues are developing an approach where we believe clinical engagement with NHS policy can be far more effective than it has historically been. In that, we have a series of steps and concepts that we wish to go through, both within the SHA and within our partner organisations in our NHS community. We have a concept and a belief that we tend to call the double helix working, and this is about developing our clinicians, developing our clinical leaders, giving them a greater understanding and knowledge of NHS change, and more importantly, valuing them and bringing them into the discussions more effectively in the present. We're aiming to get a joint relationship between our senior managers in the NHS and our senior clinicians so that we can have effective engagement and ownership of change and what change means in communities, with the hope that these leaders then will have equal influence and effect within those communities to make change happen more effectively. And one of the points that we'd like to really bring this to the attention of everybody is the first annual clinical congress for the North West. We are planning a congress for all our senior clinical leaders and senior clinical managers on the 27th of November. This meeting is going to be jointly hosted by the Healthcare Commission because we believe that quality standards within the clinical leadership structure are very important. Our partners at the Healthcare Commission are keen to work with us to produce such an event. We have some key speakers for that event. It will be chaired by Mike Farrar, our own Chief Executive Officer. We have Professor Lord Darcy attending the event, and also the event is going to be supported by organisations such as the NHS Alliance, the Clinical Leaders Network, CSCA, the IT organisation, and a number of other people that will be involved in a marketplace situation to help discuss what they themselves are doing with our clinical leaders and how their support can help our clinical leaders be more effective in leadership roles. At this event, the Healthcare Commission wished to discuss the way forward for the future from their role, and Ian Kennedy, their Chief Executive, is also going to be at the event, co-hosting it and setting up some workshops to work with the Healthcare Commission. So in summary, we're looking forward to taking the clinical engagement ideas to a higher level. We want world-class clinical engagement in this Strategic Health Authority. We believe we can achieve it. We believe that this can be done in combination with our other colleagues who work in the organisations within this North West footprint, and we are very excited about the prospects for the future.